Hello, this is my manuscript poster presentation on Virginia athletic trainers' perceptions of the athletic training profession regarding the impact of the COVID-19 pandemic. So, just a little background information. COVID-19 started at the end of 2019 and has since then just wreaked havoc across the globe, across the country. It has caused millions of illnesses and deaths, and it has also created the loss of jobs, and it has impacted mental health greatly across the nation. And we are looking at just athletic trainers and seeing how these impacts have affected them. So the purpose of this study is to gauge the impact of the pandemic on athletic training professionals, and it is hypothesized that the biggest obstacles they've had are mental health challenges, career opportunities, and then just changes that are occurring in the healthcare professions, like not able to find gloves and masks and proper protective equipment and things of that nature. So for our study, we targeted certified athletic trainers in the state of Virginia, and we contacted them through email, posting on social media, and word of mouth. And the survey was conducted using SurveyMonkey, and we sent it out via these methods. It was available for 3 weeks of collection time. And then at the end of the survey, we collected all the data, and I'll show you how we analyze that later. But to get into the exclusions, if the athletic trainer was living in Virginia but was not employed in Virginia before the pandemic, we exclude them, and we had 2 participants be excluded for that reason. And if they had passed their BOC but had not been employed yet in Virginia, they were excluded. And then, of course, if they didn't live in Virginia, they were excluded as well. So we obtained informed consent at the beginning of our survey, and if they did not want to consent to the form, they would opt out of the survey. And in total, we had 71 participants open the survey. 16 were excluded for reasons I stated previously, or they just did not complete the majority of the survey. And then we had a total of 53 participants complete the survey, and they were included in this study. And again, the data collection took place between September and October for 3 weeks. We announced on the VATA Facebook pages and the VATA Young Professional pages, sent out emails to the VATA councils and private emails to any of our personal contacts, and that's how we collected as many participants as that we did. And then we told them what the inclusion criteria was. We sent out follow-up emails 1 week before the survey closed. And then once we had 3 weeks worth of data, we used SPSS version 25 to analyze the data. We calculated frequency percentages for all the demographics, and we also used frequency percentages for the Likert scale questions, the yes/no questions, and then any open-ended questions we just transcribed, looked for common themes, and then incorporated anything that we felt was relevant to the study. And here's some of the demographics for our participants. This just shows the ages, so they ranged from 20 to 60 plus. And so a good sum of our participants were in the range of 25 to 29. And so they were pretty young professionals. Our ethnic identity was majority white or Caucasian. Here's our regions of Virginia. We didn't have a very good sampling across all regions of Virginia. Like the Southwest region wasn't very much identified in the survey for some reason. And then we had participants across most settings possible, such as high school, college, clinic, hospital outreach, And then there was a few that weren't employed that we did include in the survey. And then looking at their experience, we asked about experience as an AT and then how long they had been at their current setting. And so we got a wide range of experience and how long they'd been at the setting, and they didn't necessarily correlate with each other. So, to our results. As I said, I wanted to focus on the mental health aspect because I thought that would be a big part of the impact of the pandemic. And we did find that the pandemic had a very big impact. 46 participants claimed they did not have a pre-existing medical condition before the pandemic occurred. And then 38 said they had not been diagnosed with a mental health condition. So there is some difference in those two things. 5 participants did have multiple mental health conditions. And these were the mental health conditions that we did have answered. So some people did have more than one, like I said, and they range between depression, anxiety, PTSD, and ADHD. And then we had a bunch of people say that their mental health had changed because of the pandemic. And then about 54% had access to psychological services through their employer. And many said their friends and family relationships changed because of COVID-19. And this is just the breakdown of the mental health symptoms that we asked them about. Many of these questions were derived from the PHQ-9 questionnaire, and there's some other ones added in there. But this is just a breakdown of how they ranked their symptoms. And so there's a wide range of symptoms between all of these participants. And you can see, or looking at like the sometimes and often, how high these numbers are in that category, like how often these symptoms are occurring, and that just shows you how detrimental this pandemic was on mental health. Because typically if you have a score of like 4 to 9, you could have a mild depression or other mental health disorder. And so just having 2 of these could mean you have depression. So I thought that was really interesting. And then looking at how they felt their professional responsibilities and accountability were impacted by the pandemic. And you can see on this chart if they felt confident in their training and education and being prepared for the pandemic, if they felt confident in the ability to return an athlete to play after contracting COVID, and then even looking at continuing education units, if they were able to get those continuing education units while they're on lockdown from the pandemic. And this was like a wish-wash of some people felt like they couldn't and some people could, and CEUs are really important to maintain certification. And then we also looked at like if they felt their peers were, if they felt accountable for their peers, the coaches, their athletes, and even their other administrative staff during this time. And then we also looked for safety if they had been exposed or contracted COVID. And for the most part, our participants had not been, and they generally felt safe carrying out their role as an athletic trainer. And safety can play a big part in mental health as well, because if you don't feel safe, that's going to play a role in depression and anxiety. So overall, our findings really showed that mental health, interpersonal relationships, and professional outlook had changed because of the pandemic, and they can definitely be correlated to the pandemic. And so looking at the 5 domains of athletic training, they have all changed. Like the profession is completely changed. I mean, we're still able to provide care, but the way we're doing it and going about it safely has really impacted the profession. And so are these changes going to be permanent after the pandemic is over? Not sure. But one thing I did find was this conservation of resources theory states that people do their best when they're able to obtain, retain, and protect resources. And that has been really hard to come by because of the pandemic. Some resources aren't able to be acquired, and if you feel like it is preventable, like those resources should be available, you're going to be stressed. And so this is making healthcare providers stressed because they are like, we need these resources, we can't get them, we should be able to get them, and that's leading to more stress. And then just being an essential worker, like athletic trainers are healthcare providers, and many felt that they weren't seen as such, even though they're out there on the front lines. And that plays a role in mental health as well, because you feel like you should be appreciated, you should be able to go to work and get your job done, and there's things in the way of preventing that from happening. So unemployment has played a big role as well in mental health, and some people just don't want to go to work because they don't feel safe, or either they can't go to work because there's not a need for them. And so all of these things have played a role from the pandemic and in our mental health. And so these symptoms such as loneliness, helplessness, just general anxiety of like, my job might not be here because sports might not happen, or because sports aren't happening, I don't have a job. All of these things are things athletic trainers are thinking of. And some limitations that I found were we didn't really have a good gauge of these symptoms of mental health before the pandemic to really get a good gauge of how they changed. But from people saying they didn't have a mental health condition and then now they have all these symptoms, it kind of shows that they probably didn't have one, but now they have all these symptoms, so there's likelihood that they have one now. And then most of our participants were white females, so it wasn't a good sampling of the whole population, even though this profession is leaning towards more female. And then we also didn't have any professional sports or industrial setting athletic trainers participate in the survey. So what I think this means for the profession is we need to collaborate more with the healthcare professionals. Like when athletic trainers go into the hospital system, they should be seen as a healthcare provider providing care in that way. Just because we have a different training, we do have healthcare training. We have the skills needed, we just use them in a different capacity. But being able to work with more interprofessionals and provide patient care and provide a well-rounded patient care. And these changes are affecting mental health, professional outlook, and many of these athletic trainers may want to change professions because of this, or they just want to be seen as a healthcare provider. And I think administration could do more to appreciate athletic trainers and understand the challenges faced by ATs, actively take steps to help with their mental health by providing these resources, give them support, help them make COVID plans and enforce them so they feel more safe. And then the ability to use technology to provide patient care when we can't see face to face. Like administration needs to be able to provide these things. We can't just do them on our own. And so I think that's what a lot of athletic trainers are wanting from this pandemic is positive changes, permanent changes to progress this profession. That is all I have.